A very good evening to all of you. Today we will begin with surgery. Surgery has a good weightage as far as NEET PG is concerned. About 25 to 30 questions come from surgery. So if you master this subject, you are definitely going to get your NEET PG seat. So most common cause of small intestinal obstruction is A. Intussusception, B. Idiopathic adhesion, C. Tumors, D. Postoperative adhesions. They are postoperative adhesions which cause the small intestinal obstruction. Now let's move to the next question. Cox peculiar tumor is A. Basal cell carcinoma, squamous cell carcinoma, ulcerated sebaceous cyst, D. cylindroma. Now, what is Cox peculiar tumor? It is a sebaceous cyst, a linked growth that can resemble a squamous cell carcinoma, but it is not a squamous cell carcinoma. The proliferating cyst is usually solitary, but it often arises from a simple tricholemal cyst in the hair follicle epithelium. So the correct answer here is C. False about gastric lymphoma is A. Stomach is the most common site. B. Associated with H. pylori infection. C. Total gastrectomy with adjuvant chemotherapy is treatment of choice. 5-year survival rate after treatment is 60%. Now, let us look at the options. Stomach is the most common at extranodal site of lymphoma. It is of two types, primary and secondary. Primary gastric lymphoma is lymphoma of stomach, which exhibits no evidence of liver, spleen, mediastinal lymph node, or bone marrow involvement at the time of diagnosis. Primary gastric lymphoma is mainly non-Hodgkin's lymphoma of B-cell origin. Most of the primary lymphomas arise in MALT. MALT is usually associated with chronic H. pylori infection. So, low-grade MALT lymphoma are thought to arise because of chronic H. pylori infection. These low-grade lymphoma may later on degenerate to high-grade lymphoma. Immunodeficiency and H. pylori infection are risk factors for B-cell lymphoma. Most common site of involvement is gastric antrum. So the correct answer here is total gastrectomy with adjuvant chemotherapy is treatment of choice. Please click the link in the description box to join the 2-day NEET PG Breakthrough Blueprint to be held on Thursday and Friday. Which of the following preservative is used while packing gut suture? A. Isopropyl alcohol, B. Colloidal iodine, C. Glutaraldehyde, D. Hydrogen peroxide. It is isopropyl alcohol. C. 10% isopropyl alcohol is routine packing fluid used in packing catgut sutures. Catgut is available in glass tube containing isopropyl alcohol and small quantity of water. This catgut is prepared from the intestine of sheep. Primary hyperparathyroidism, pheochromocytoma, may be associated with which type of thyroid cancer? A. Medullary carcinoma of thyroid, papillary carcinoma of thyroid, anaplastic carcinoma of thyroid, follicular carcinoma of thyroid. See, this primary hyperparathyroidism, pheochromocytoma, may be associated with medullary carcinoma of thyroid. It is characterized clinically by medullary thyroid carcinoma, pheochromocytoma, hyperparathyroidism. Approximately 70 to 95% of individuals with MEN 2A develop medullary thyroid cancer. What is meconium illness? Meconium illness is associated with A. Cystic fibrosis, B. Infant of diabetic mother, C. Hypothyroidism, D. None of the above. It is cystic fibrosis. Which of the following nerve is commonly damaged during McBurney's incision? A. Subcostal nerve, B. 10 thoracic nerve, C. 11 thoracic nerve, D. iliohypogastric nerve. It is iliohypogastric nerve. The nerve commonly damaged during McBurney incision is the iliohypogastric nerve. Damage to this nerve results in development of right inguinal hernia. McBurney's incision is commonly done for appendectomy. In an oblique incision, it is made in the right iliac fossa, about 5 cm above and medial to anterosuperior spine at the right angle to spinal umbilical line. Dysphagia lassoria is due to A. Esophageal diverticulum, B. Aneurysm of aorta, C. Esophageal valve, D. Common compression by aberrant blood vessel. Dysphagia lassoria is disorder of swallowing caused due to vascular anomalies and include a right aortic arch, a double aortic arch, a vascular constriction ring formed by PDA, abnormal right subclavian artery, abnormal innominate artery. Diagnosis is made by liquid arteriography. Surgery for undescended testes is recommended at what age? A. 6 months, B. 12 months, C. 24 months, D. 36 months. It is 6 months. Optimum age for surgery in case of undescended testes is 6 months. The surgical procedure done is called orchidopexy. Earlier intervention should be considered in order to theoretically prevent the complication of cryptorchidism that may be manifested before 1 year of age. Please click on the link in the description box to join the 2-day NEET PG Breakthrough Blueprint Masterclass. Dacron vascular graft is a textile biologic, textile synthetic, non-textile biologic, non-textile synthetic. It is textile synthetic. Now, this Dacron graft is a type of textile synthetic graft. It is associated with increased risk of thrombosis due to low flow rate. They are pre-coated with collagen, which eliminates the need for pre-clotting. It is now reserved for aortic and high-pressure, large diameter bypass graft. What is the most common position of appendix? A. Pelvic, B. Paracolic, C. Retrocecal, D. Retroperitoneal. It is retrocecal. Double bubble sign is seen in duodenal atresia, duodenal stenosis, volvulus, all. In fact, all of the above is the correct answer. What happens? Double bubble sign is seen in duodenal atresia, duodenal web. It is seen in duodenal stenosis also, Lad's band, annular pancreas, malrotation of gut, preduodenal vein. Now let's move to the next question. Curling ulcer is due to seen in A. Burns patient, B. Patient with head injury, Zollinger-Ellison syndrome, analgesic drug abuse. It is seen in Burns patient. Curling ulcer or stress ulcer associated with Burns and most commonly found in the first part of duodenum. Curling ulcer is an acute gastric erosion resulting as a complication from severe burns when reduced plasma volume leads to ischemia and cell necrosis. All are true about amoebic liver abscess, more common in females, more common left lobe of liver, metronidazole mainstay of treatment, D and B, except D and B. Indication of liver transplant are all biliary atresia, sclerosing cholangitis, hepatitis A, cirrhosis. See, cirrhosis, biliary atresia, sclerosing cholangitis, these are all indications of liver transplantation. Hepatitis A is not an indication for liver transplantation. Care sign seen in splenic rupture is A. Pain over left shoulder, B. Pain over right scapula, C. Periumbilical pain, pain over renal angle. It is pain over left shoulder. What happens? In splenic rupture, the pain may be referred to the tip of left shoulder. This is known as Care sign. It occurs due to irritation of the undersurface of diaphragm with blood, and pain is referred to the shoulder through affected veins. Breast conservation surgery not indicated in A. Large pendular breast, B. SLA, C. Diffuse microcalcification, D. All. It is all. Mondo's disease is A. Thrombophlebitis of superficial veins of breast, B. Carcinoma of breast, C. Malignant cust of breast, filariasis of breast. It's thrombophlebitis of superficial veins of breast. Lateral apparent thyroid refers to A. Congenital thyroid abnormality, metastatic focus in lymph nodes, tumor ovary, lingual thyroid. It is metastatic focus in lymph nodes. Most common site of CES esophagus is middle third, upper one third, lower one third. Lower is in esophagus. It is middle one third. Corkscrew esophagus seen in which of the following condition? A. Carcinoma esophagus, B. Scleroderma, achalasia cardia, diffuse esophageal spasm. It is diffuse esophageal. The most common type of tracheoesophageal fistula is esophageal atresia without tracheoesophageal fistula, esophageal atresia with proximal tracheoesophageal fistula, esophageal atresia with distal tracheoesophageal fistula. It is this esophageal atresia with distal tracheoesophageal. The best investigation modality for gallbladder stone is A. Oral cystogram, cholecystogram, B. Percutaneous transhepatic cholangiography, C. Ultrasound, intravenous cholangiography. This is ultrasound. Strawberry gallbladder is seen in gangrene of bladder, pulsing gallbladder, adenomatosis, cholestasis. It is cholestasis. Viapoma is associated with syndrome A. Zollinger-Ellison syndrome, Bernard-Morrison syndrome, carcinoid syndrome, Cushing syndrome. It is Bernard-Morrison syndrome. All are resected in Whipple's operation. A. Duodenum, head of pancreas, neck of pancreas, common mild neck. It is neck of pancreas. Now, the tendency of colonic carcinoma to metastasize is best assessed by A. Size of tumor, B. Carcinoma embryonic antigen level, depth of penetration of bowel valve, proportion. It is depth of penetration of bowel. Commonest cause of interception is submucous lipoma, macrocyberticulum, hypertrophy of submucous pair patch, D. polyp. It is hypertrophy of submucous pair patch.